Hello, we are Group 10, and today we will be discussing the changing face of the American healthcare system. Our group members consist of Francis Owens, Jasmine Luna, Tiffany Berner, Patrick Sotelo, and Jason Suriyamont. There are different ideologies from capitalistic beliefs, social and cultural values, and political beliefs. There are growing special interest groups such as liberals versus conservatives and public opinion. Americans have many different values and beliefs about government involvement in private lives and business. This also shows in lobbyist actions and advocacy organizations. There is a need for individualism, self-reliance, and yet at times it becomes egalitarian when the economy demands it. Based on ideologies of federalism that there should be a separation of power between the national government and the states. The American government structure consists of three branches of government: an executive branch, a legislative branch with a bicameral legislative branch, and the justice branch. Power players are influenced by special interest groups. Political and citizen coalitions are formed through common values and beliefs on issues presented for legislation. So what changed in the 1900s? Physicians joined together to form the AMA, which became a powerful political voice. Hospitals became organized businesses where physicians and nurses came to train in patient care, causing healthcare costs to increase. Unions began providing illness pay for members to protect against wage loss. States also created workers' compensation insurance to protect wage workers from loss caused by injury or death while working. So why was it needed? Veterans needed assistance with access to healthcare and costs. Elderly needed financial assistance and access to healthcare and living expenses. Families below the poverty line needed assistance with access and costs. More families became uninsured due to economy crisis and fluctuations causing higher unemployment and an increase in uninsured Americans. So what were some of the impacts of federalism on healthcare legislation? Federalism creates the lines between who will provide regulation funding for legislation. Federalism allows constitutional challenges to be made on legislation to the Supreme Court. With the healthcare legislation, federalism becomes blurred as more government involvement becomes cooperative between national and state funding and regulating. Here are a list of major federal legislation and other important legislation that supports them. In August 14, 1935, the Social Security Act, including welfare, was put into play. On July 30th, 1965, Medicare and Medicaid was signed. In 1974, the Employee Retirement Income Security Act, also known as ERISA, came about. In 1974, the Employee Retirement Income Security Act, also known as ERISA. In 1986, Emergency Medical Treatment and Active Labor Act. In 1990, Americans with Disabilities Act, also known as ADA. In 1996, Health Insurance Portability and Accountability Act, also known as HIPAA. In 2009, the Health Information Technology for Economic and Clinical Health, also known as HITECH. So how did Social Security Act come about? The Social Security Act of 1935 really set the stage for the future of American healthcare. What started off as a program to help those suffering during the Great Depression turned into a program that created a platform towards universal healthcare in America. In the beginning stages of Social Security, there were a lot of issues to be addressed, and this was obvious as it was the first time in American history that the government had direct involvement with the healthcare of its citizens. So over time, there were different amendments that included more people into the program, revisions that aided with cost adjustments, and so on. Eventually, The Social Security Act would have paved the way for the Medicare and Medicaid programs that address the issue of lack of adequate care due to healthcare costs. Harry Truman became the first president to propose a national health insurance in the United States that would provide a universal program to be modeled on Social Security. Signed into law by Lyndon B. Johnson in 1965, Medicare is a federal health insurance program that is directed for elderly Americans who are over the age of 65, along with also supporting younger citizens who suffer from specific types of disabilities. Funded by taxpayers, Medicare plans such as Part A of the Medicare has no premium and only covers hospitalization, whereas Part B has a premium of about $105 a month covering outpatient expenses along with physician visits. Introduced in 2004, Medicare Part C allows patients to receive additional benefits that aren't covered under Parts A and B. Proposed by President Bush in 2003, Medicare Part D would provide prescription drug benefits to enrollees. Regulated by the Centers for Medicare and Medicaid, the False Claims Act of 1986 seeks to penalize those who participate in the fallacious claims regarding services. Some of the most common violations include billing for services without the presence of a provider, upcoding, and diagnosis-related groups, also known as DRGs, where providers are paid not per service but for diagnosis. Along with Medicare, Medicaid was signed in 1965 to expand health coverage to low-income people in the United States. The federal government has primary oversight of the program. However, each state sets its own criteria. Throughout the years, Medicaid has had new acts and programs. Some of the programs include the Prescription Drug Rebate Program and the Children's Health Insurance Program. Due to the rising cost of healthcare in 1967, Medicaid limited its eligibility to the needy. With the help of the Children's Health Insurance Program in 2003, the eligibility for children expanded. Put into action in 1974, ERISA protects retirement and pension plans and prohibits states from requiring coverage mandates. It allows any self-insuring employer to be exempt from state regulations. Limited state health policy from regulating employee benefits as well. Title I of ERISA is the protection of employees and their beneficiaries participating in employee benefit plans. Employee Benefit Security Administration is responsible for administering and enforcing disclosure and fiduciary reporting of Title I of
ERISA. Title II of ERISA regulates standards for retirement plans to qualify for special tax treatments.
On August 21, 1996, President Clinton signed the Health Insurance Portability and Accountability Act of 1996 into law. HIPAA was passed to establish a national framework for security standards and protection of confidentiality with regard to healthcare information. HIPAA provides for healthcare coverage, such as an anti-fraud and abuse program. It transfers of patients' information between insurers and providers. Also, all healthcare providers must comply with HIPAA. Those who violate HIPAA standards face fines and penalties. Health Information Technology Economic and Clinical Health Act was signed into law on February 17, 2009 by Barack Obama as an effort to improve the health of Americans and the performance of the healthcare system. The HITECH Act supports the concept of electronic health records to improve the quality of care and prevent medical errors, along with reducing the cost through decreased paperwork. The HITECH Act was designed to promote widespread adoption of health information technology to permit electronic sharing of clinical data among physicians, hospitals, and other healthcare providers.
Thank you for taking the time out to listen to our presentation.